Okay, scheduling chaos is not just an operations problem. And since it affects both revenue, resource efficiency, and patient trust, today we're going to be going over how to eliminate scheduling chaos. My name is Steven Sinclair. I currently work as a director of operation with approximately 15 years of experience in the BPO business. I'm specialized right now in radiology, appointment scheduling, and a few other steps of the RCM process, including the collection of unpaid balances from out-of-pocket amounts and some enrollment, insurance verification, and benefits. All right, so it's not just going to be me, guys. I actually have the privilege to have with me Jason Newmark. He's going to be our guest today in regards to speaking about eliminating those chaos. The reason why we have him here is because he's the executive director of AHRA with over 25 years of experience in healthcare leadership experiences. So let me just quickly have Jason introduce himself and let us know how fun this is going to be today.
All right, well, Stevenson, thanks for having me on. I'm really excited. Obviously, scheduling is the front door, right? Everything starts with scheduling. And in my experience, which, like you said, over 20 years of consulting experience, as well as running day-to-day scheduling offices, as well as radiology services for a large academic medical center, I can tell you that there's a lot of lessons learned, a lot of things where we failed, a lot of things where we tried and made some progress and some pretty interesting ways that I would say we made some definitive progress to improve. And by no means was it perfect, but lots of perspectives to share, and I'm just excited to be here today. So thanks.
Awesome. Thank you very much, Jason. Now, whether you're joining us as a CEO, a CFO, a COO, or a clinical leader, what we're going to explore today has direct implications for your bottom lines, your staff, and most importantly, your patients. Because we understand that patient satisfaction is definitely key to ensuring that you're guaranteeing that income or revenue. Things that we'll go over today. First, we'll go over why scheduling is breaking and what's the cost for the providers. We'll identify where misalignment happens most often and a framework for cross-team scheduling alignment and how imaging centers can successfully streamline scheduling across departments. All right, so let's quickly talk a little bit about what scheduling chaos actually entails. So we're not just talking about an operation inconvenience, right? We're talking about something that hits three specific pillars within the organization. First of all, we talk about revenue. Revenue comes from missed appointments, which will literally turn into a lost income. Now we go into the resource efficiency. We know we need people to the job, but we're talking about staff being burnt out, trying to manually fix those issues that the system may have caused errors in, or other folks with the not the proper oversight or lack of information could have caused as far as errors are concerned. And last but not least, and I'll say most importantly, patients trust. When your scheduling system breaks down, your patients will actually feel it. They'll feel that your processes are taking too long. They'll try to wait or they'll literally leave, but then there's the risk of them not coming back because we're talking about patient satisfaction being one of the important things. Because satisfied patients return to your centers, which means guaranteed income. Jason, I don't know if you want to quickly jump in here and add something.
No, I think you're hitting on the main points. I think if an inefficient front door, right, leads to exactly what you're saying. I think first and foremost, you challenge your own mission of your organization, which is to give people timely access to care. The providers need imaging so they can diagnose what's going on and help put care plans together. Or if a care plan's in effect, is it working? And if you delay those access to medical imaging, you're going to delay care overall, which then challenges your mission. And I think you're absolutely right. The downstream effects of that is you have upset referring providers who are going to send patients elsewhere. You have upset
Mhm.
patients who are going to say, I'm not going to wait. I'm scared. I'm nervous. I'm going somewhere else. So that starts to break the reputation of your organization, which ultimately then causes revenue problems, right? Suddenly you're not going to have those people coming to you. And then you're going to have lost revenue, underutilized equipment, things of that nature. So it's essential that with all this chaos, people really, really take the time in the moment to figure out what can we do to address our front end and improve upon that, which is what we're going to be talking about today.
Awesome. So we'll definitely cover in today's session, sorry, we'll try to unpack on what's broken and what it's costing us. We'll walk through a 5-move framework to align scheduling across departments. We'll also do a real world case study that shows some of the strategies that we're talking about today and a practical first step that you can take in the next 9 days. Um, all right, so now let's quickly dive into what burnouts really means and what it's costing us, both revenue, both on the side of the revenue, but then looking at our staff that are actually leaving and also how it's affecting the patients. So here, there's 3 different lenses that's displayed on the screen here. We talk about looking at it through the COO's eyes, where it's a matter of throughput, workforce optimization, and operational integrity. But then you'll see that there are chaos on a day-to-day for the staffing plans. Now, if your level of staffing is not correct, so that means that you may not be responding to all the calls, meaning that in the scheduling process, there's a lot of patients that you could have scheduled that will have to either call back or wait for days for their referral to actually be touched since the referral is received from the center. And that simply means either delayed revenue or folks that are just going to migrate to other centers. And when it comes to the CFO lenses and looking at every no-show, we just talked about those that will just migrate to other centers. So no-shows will cause that. And every call that actually drops is just revenue leaking away from your overall margin. Now, Jason, in your experience as an executive director in HRA, what could you tell us about that lost revenue that is caused by those calls dropping or the no-shows? And give us a bit more on staff burnout as a whole, if you would.
Sure. Yeah. So as I said earlier, I think we can all relate to the fact that less schedules in, less patients in the system, less efficiencies, and obviously you lose revenue. But I think what I really want to drive in more is what you talked about burnout. And that's just a reality today, right? Like people are getting sick. We have older people that are living longer, and that's a good thing. And they also have access to a lot more medical care than maybe they had in the past. Yes, there's new innovative technologies and new services coming down the pipeline, but at the end of the day, what that translates to is a lot more work for these call centers. Now, I say that with a caveat. The key is those call centers trying to find out how to be the most efficient and to ensure they're training their staff and working with their staff to make their jobs the most efficient and easy as they can be, right, in a complex environment. So I think about burnout and some of the things that I saw when I was running radiology departments or running scheduling. I think the number one thing I saw is, now I'm going to go here to a centralized scheduling department, which is pretty common in larger health systems where they'll have a group of folks that will schedule for a lot of different areas. It could be medical imaging and other service lines. It could just be for the medical imaging, but oftentimes it's not in the department. And what I used to see there is that group would always feel disassociated with the main department. So they would
Mhm.
maybe consider radiology their client, or the radiology department thought of them as their hired schedulers. To me, that's the biggest problem there was. That's going to lead to burnout because you don't feel part of a team. You don't truly understand who you're scheduling for, why you're scheduling, what is the patient experience, what are they going through when they arrive, and vice versa. The radiology department doesn't appreciate what it's like to sit in the seat of a call center when the phone is just ringing, 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 or the emails are coming in, coming in, coming in. It feels like this never-ending flood of work, and can I even catch my breath? So to me, I think that there's a lot of challenges. There's opportunities to address that burnout, and I think having a engaged, well-trained staff that then has efficient operations allows them to be flexible, to think of new workflows, and to really make that experience of the referring provider or patients exceptional, which then leads to more referrals down the line and utilizing your capacity and things of those nature. So to me, it's some things we used to work on for to address the burnout was we would interact with the scheduling team frequently, right? We'd have our radiology the director or the radiologist, the chair, or the modality leads, whatever you want to call it, meet with the scheduling team, talk about what the challenges they're seeing, make sure we can address those elements, make sure that we're understanding what it is we're trying to schedule for. So have the schedulers come to the department, see what a modality looks like, maybe sit in an MRI, appreciate what it's like, what it feels like to sit in an MRI, what it feels like to sit in a CT room, understanding the flow from the parking lot through registration to your modalities. I think just ways to engage the schedulers, so they felt more of a team. That's kind of the number one thing I would think of. And then secondarily, I would say is constantly looking at ways to enhance the training and the tools they have, right? Is the system easy to use? Is it intuitive? Are the rules changing every other day? Have the rules not been changed in years? Things of that nature, to sort of trying to figure out ways to just really make the schedulers feel a little bit more supported. And I think my final point, just as I'm going through here, is constantly say thank you to the schedulers, right? They are your front door. Yes, they may make mistakes, but they need to feel valued, recognized, and understand their importance sort of in the care planning process.
Okay, well, that was a lot to unpack, but you've actually covered on a lot of good points that we're trying to make with this session today. There's one thing I thought you were going to touch on that one since we actually spoke of it a little bit earlier. The next thing I think is very important here to talk about when it comes to misalignment is poor patient experience. So poor patient experience is definitely something that I wanted to touch on because I feel it's definitely the first indicator of your business, sorry for the lack of better word, sinking. Because no patients, no revenue. And the patient experience is what's going to determine whether they're going to be coming back or they're even going to want to go to your center because there's that one thing that we all know of, which is word of mouth. The moment someone gets a good experience from your center, they'll tell a brother, they'll tell the neighbor, they'll tell a coworker. And then once they need to be referred by their PCP, they'll say, this center is close by and I wish to go there. I have a friend that goes there and they have great service. So, how do you feel about patient experience as a whole? And what's your experience over the years when it comes to patient satisfaction overall, we'll say?
Yeah. I think it's a great question. I think twofold thoughts here. So the first was, in many cases, it's not always the patient calling to try to schedule their appointments. And I'm sure you see that as well. Oftentimes the referring provider is taking care of that, right? So the patient is more sitting on that sort of behind the scenes and waiting is when I can get in, right?
Mhm.
How quickly can I get to an appointment? I'm nervous. Someone just told me something might be wrong. So I think that patient experience piece is more access to care and how quickly they get in. Then obviously, unrelated, I'll say, to the scheduling department per se, is does the patient understand their preps? Do they know they weren't supposed to eat? They weren't supposed to do X, Y, or Z, or they're supposed to wear certain clothing? Do they understand where to show up and when to show up? Like how much earlier beforehand? Do they appreciate that you might get a phone call to get pre-registered? Or here's a link so you can go on and pre-register yourself and take care of things in advance. Those are all the things that sort of happen beforehand. And I think making sure the patients are informed has a very big impact on that patient experience side. Then obviously when they arrive, was it easy to park? Was it easy to access? Did they come on through? Were they seen on time? Were they sitting in a sub waiting room? All the elements that kind of go with that. So I think that's my world, I think, on patient experience. And we had a lot of feedback there, right? So sort of a combination of, were we explaining it up front with our call center and how they were going through it? And then all the other touch points along the way, where it was a succinct, were we together? Were we aligned? Were the team saying the right things? Oftentimes, unfortunately, what happens? Something breaks along the way, and suddenly the schedulers say, "Oh, that's because so and so gave me the wrong information." And then you check in, and the registration folks go, "Oh, you didn't do this? Oh, scheduling should have told you." These are bad patient experience moments, right? When you're
Definitely.
trying to read it, hey, we're all in this together. We're all one team, and how do we make this as seamless as possible? The other piece I will say, the second fold I was going to say for the patient experience directly is that I'm seeing places where patients can call and schedule. So you want to be able to answer quickly so they're received. And secondly, I'm seeing places that are opening up more self-scheduling options. I'm sure you see that as well too, where a patient can go in and actually schedule certain modalities that maybe aren't as complicated to schedule. Most
Mhm.
common, I think, of like a screening mammography, right?
Correct.
Where you may or may not need a referral for that. But those are kind of elements that I think of when you talk about patient experience. Essential though, that all these things are working in harmony, and that's what gets people to come back. They say it was easy or seamless. Those are the words you want to hear from the patient.
Yep, definitely, definitely. Great point there. So now we're gonna move away from the referral doctor. We'll move away from the patient themselves, and before diving into the five moves that we'll be proposing to the folks today, I will mention that poor reporting and accountability is definitely something that we've seen these days that have been affecting. And why do I say accountability? If there was an error that was made, if someone made a mistake, the mistake has to go back to whoever made it. Why does it have to go back? It's not to point fingers. It's really to ensure that the person is learning from their mistakes, because there's no other way of understanding why you should not have missed maybe the with and without as you were scheduling that appointment with contrast or without contrast. For you to understand this, you have to see the errors that you made, how it affected the patient, since the patient was there for 30 minutes before being called upon, and then realized that they're not going to be able to perform the procedure because the person probably put on some deodorant and is not allowed to get into the room. So the accountability piece is definitely important. And these days, we do see a lot of instances where the first reaction is to correct it and not have it go back to the person. And what ends up happening is that you start stacking up the number of errors that are coming through because you're not letting it go back to who made the mistake. So there's a lack of accountability there. For
Okay.
reporting, if errors were reported and went back to whoever made them, and you had a system where you were keeping track of everything, all mistakes that were made and addressed, that report would help you identify. You were talking about training earlier. That report will definitely help you identify training opportunities that should have been addressed or that should be addressed in the future as you hire new folks. It can also help you identify specific areas of opportunities that should be addressed during one-on-one sessions within the BPO industry or at the center. The person at the front desk may be missing information that was shared with the schedulers but wasn't shared with the front desk. And the front desk started turning patients away, saying it, not being aware of the new process in place. Just wanted
Okay.
to throw this in there, but then to really ask you a question. From your experience as a former director of ops in ambulatory and diagnostic services, where do you see the biggest misalignment today between operation in scheduling, and access strategies?
It's a great question. And I think the misalignment actually is the right term. And I think it's a misalignment or just like a miss in general, where it's an opportunity for, I think I said earlier, is to make sure that the scheduling team feels connected and part of the technical and clinical team, right? And they really are one, right? They're aligned. So that both sides can appreciate that they need each other and they can understand the implications of when something goes wrong, how do you know what that impact might have, right? On delayed patient care, the bad patient experience. You might have an upset referring provider. You have a stressed out technologist, or flip side, you have a scheduler who says, honestly, every other day I go in the system and the rules change, right? And
Hmm.
today I only can schedule it when Stevenson's wearing his white jacket and his striped shirt, or when the moon's out and Jason's here today. Like there are rules like that, right? Built into the system. So I think some of that just comes again to the lack of sort of alignment and the feeling of feeling like you're feeling like you're not one team. I think some of it's also that you're not necessarily all in the same place, right? Oftentimes scheduling is could be remote or it could be in a different location, which can work, by the way. I think it can work really, really well. It just means you have to have more common or more frequent conversations and more interactions where people are getting together and talking about what's working well, where are our questions. So I think the alignment just comes from a lack of consistent open dialogue of looking at what we can do better or what's going well so we can sort of recognize each other as well as put a list of the things we need to address. I think at times too is that the metrics are fantastic and I love what you're talking about because the new data analytics you can pull out are amazing, right? From the duration of the calls or words that were spoken that shouldn't have been
Hmm.
said or all sorts of elements of how many keystrokes you took to get through something of those elements. But sometimes they're just numbers. And I think numbers are important, but tying those numbers to what it actually means for the patient is essential. Because nobody that's in that scheduling world wants to make a mistake.
Hmm.
They want to provide great service. I think part of the challenge that I see a lot is that the systems are just not built that well, right? Either they're not set up right, or when they were set up, the templates were built in a very interesting way to look at where it creates gaps in there that leaves blank times, or the rules are so complex that they're hard to follow. So it's really hard for someone to come in and be an expert in all things scheduling for all medical imaging type of services. So I think that sort of me is where I see some of that misalignment. Not so much that people don't want to excel together, that they just are seeing success through different lenses, or they're not feeling totally part of the team. That to me is what's always resonated.
Yeah, I feel like this is definitely a great segue to move into the five moves to eliminate chaos. So we'll shift gear into the how.
Mhm.
Because I know everyone is probably waiting to see, okay, so how do we do this? So the good news is scheduling chaos is solvable. These are going to be five strategies that we'll go through, and we've seen that they work in complex healthcare environment. And Jason and I will try to walk you through them and give you some insight of our personal experience and professional experience with them. So the first thing that we'll talk about is cross-functional scheduling governance. So this is going to be the we're going to start with the foundation governance. You simply cannot fix scheduling in isolation. If your call center is optimizing one thing and your clinical team is doing another thing, you're going to end up with gaps, delays, and obviously confusions because processes are not going to be understood across the board. So, step one is definitely getting everyone to the same table. That means clinical operations, call centers, access teams, finance, IT, if you need them, all aligned under a single scheduling strategy. And once that group is in place, you would have to define KPIs altogether. I like KPIs. It's just that common ground where everyone just meets and understands what the how things affect and what to do and the importance of things and what we're trying to achieve. And things like access time, we'll say another KPI like no-show rates and provider utilization are good KPIs to look at. And when everyone's looking at that same data and working towards that shared goal, accountability becomes a lot easier. So how do you feel about what I just said, Jason? Do you do
I
you, do you
couldn't
feel
I
there's
couldn't
anything
agree
that
with you. I couldn't agree with you more. I think that this is absolutely number one. Before we start anything or any opportunities for improvement, getting everyone aligned, it's what I've been saying all along, right? Uniting the group so that the scheduling team feels part of the clinical team, feels part of the technical team. One goal, one strategy. What are we trying to accomplish? What's the
Mhm.
experience we want for refers, for our patients, for our techs, for our scheduling team? I love where you're going with that. And absolutely 100%, you need to be able to measure it, right? Measure for your own self. Are we progressing towards the goals that we have? Right? What are our stretch targets? How do we compare against our competitors in the marketplace? How to compare against national benchmarks or international benchmarks in terms of how quickly we answer the phone, X, Y, how quickly people get in. Are we meeting clinical guidelines for example, time from a screening mammography with a finding to a diagnostic or a diagnostic to a procedure, those kind of things. And I love that. And then just clearly making sure that people appreciate what those numbers mean to all those little key stakeholders. So I couldn't agree with you more. I love this first one. Step one,
Awesome.
all the way.
Definitely. And I love the fact that you mentioned benchmarking. And one thing I'll add to it is also the stretch goals that you mentioned as well. I feel like step goals are undervalued in this market and they are so important. If your goal is to meet 6 minutes in average handling time, when the group is new, if you just hired these folks, they are not going to do 6 minutes. You have to allow them time to ensure that they're reaching that goal once they're comfortable enough to not make mistakes to reach it.
That's right. And how about
So,
I even go further? How about there's also you might have certain referrers that are chatty, right? Like me, chatty. And you might say,
like
you know
us.
what? Yeah, it's us. We're gonna give them a little more time. They might need a little bit more of that special touch or experience versus trying to get them through the parts. Other folks just get me in and out. Let's roll, right? Let's roll.
Right.
So yeah, I
Hmm.
totally agree with you.
All right, so let's go into step two to build capacity resilience. So this one's about creating your system's shock absorber, I like to say. So when volume actually spikes, you're not scrambling. You start by using predictive analytics to get ahead and ensure that your forecast can actually respond to the demand, adjust the staffing when necessary, and even open scheduling blocks strategically before things get tight. Because how awful has it been in the past? Because I've seen partners struggle because of poor forecasting. And one of the case studies that we'll go through may be in regards to that. So I'm not going to spoil it for everyone. But but forecasting is so important that forecasting allows you to increase both revenue and also avoid burnout, because knowing the volume that is to come ensures that you actually have the right number of folks to respond to that demand. And once those calls come in and the folks are responding to those calls, they'll be scheduling those appointments, they'll be touching those referrals, they'll process those orders, they'll do the data entry correctly. Um, and when things do shift, like high no-show cohort, you've got also an overflow strategy that's in place. For example, maybe you allow controlled overbooking in specific clinics where you know that no-shows are common. So if my no-show rate is 20%, then let me go ahead and overbook by 10. Then instead of having a 20% no-show rate for this month, then it'll really be 10% since I've actually planned for it. And that increases the revenue that comes through. So Jason, when imaging centers implement this kind of capability resilience, what kind of pushback do you hear from the staff, and how do you work through it with them?
Yeah. I would say I don't know if it's so much pushback. I think back in I say back in the day, it's been several years since I've been in the direct oversight of these areas. We didn't do this as well as we probably should have. Like just reading it and hearing you say it now, it's one of those things you're saying, huh, wish I could take the younger me and go back and say, we could have done this better. We should have spent more time doing this for all the reasons you said. The data is available, and that now it's much easier to access, with the new data analytic tools and things of that. I don't think there's much of pushback as much as a want to understand it. This would be fantastic for people to be able to plan their staffing and to understand where we can pull and push or block and just manage our schedule a little more actively than here's what we built. This is what we're going to live by. Here we go. Right. Whether we're full or busy or not, this is what we're going with. I think having that flexibility, and again, it goes back to just much, much more frequent and consistent collaboration between the scheduling department, that's a lot of these metrics and data, with the radiology department, all the data and metrics they have, getting the teams together to talk about how can we look forward, what's working well, where can we massage things, where are we seeing those backlogs, how can we plan more accordingly. I think doing that on a more consistent basis, right? Maybe we did it annually, maybe it's every week, maybe it's every month, maybe it's every day, just a quick check-in. But I think I'm not so caught up on the pushback and the resilience. I think the only worry is someone might say, oh my gosh, you're going to put so much more work on me, or you don't understand my workflows, and so easy for you to overbook, but you don't know what it's like on the other end. Well, it will be okay as long as they're talking, right? If one group does it in an isolation, then it's a whole different piece. But I look at it as instead of sort of pushback as more as a great opportunity to really align and get people together. This will make things better for both sides or all sides.
Yeah, definitely. Because definitely the overbooking is an issue, but then having an empty room all day is also an issue because
That's
it's
right.
definitely lost revenue. So next thing we'll talk about, now that we talked about staffing properly and then having a strategy to avoid those downtime, I'll call them, let's go into some smart decisions that could be taken. Here, move number three, turn call center functions into strategic access point. So too many call centers are stuck in reactive mode, answering calls, logging issues, and moving on. But your call center can be so much more than just that. It's just frontline. This is your frontline access channel. And when it's done right, it becomes a strategic asset. So here's how you can actually try to like shift the focus in your center. Move from that reactive to proactive by anticipating needs instead of just responding to them. Um, Doing things like staffing analysis so you can actually forecast the headcount that you need instead of trying to hire to be able to actually respond to that need and that call volume. Make it omni-channel. Let patients reach out to you however they want, phone, text, chat, web, and use centralized routing to reduce transfers and dead ends. Um, and I don't know, am I missing anything, Jason?
No, I think what I'm hearing you say is just, different ways to think more strategically, and you're trying to make the experience for patients and referring providers easy as it can be. So more options. I love your omni-channel, right? Doesn't have to just be I have to pick up a phone,
Yeah.
right? Maybe I send a text, maybe I have an email, maybe there's a spot you can do on your system through the web that says, here's my request for appointments. And if it doesn't need a prior authorization, you're off and running. Or if it does, you're ready to set up those processes to help that go that route. I love the routing of calls. So instead of calling a general number and being bounced around, maybe you have a group of people that are specialists in your IR procedures, or You click a button to get to the specialist who do your breast
Mhm.
imaging procedures. Um, and then I think just always looking at ways to integrate with all the data, the tools you have within your system so that when the stuff comes to your schedulers or gets you, you have all the information you need to make sure you can schedule that appointment effectively and accurately. So I think thinking forward, as I'm hearing you say, I think I
Mhm.
totally agree with you. Just ways to be more proactive than simply waiting for the call to come in.
Awesome. And the real unlock on this is integrate your call data with EHR and scheduling tools. Now, the way agents have full context, they can see history, upcoming visits, and preferences, and they can resolve things on the first touch without toggling between different systems, because it's the most frustrating thing having to open five different tools. And then while you have the patient on the line, going from the tool that shows the demographics to the one that you're going to be using to schedule the appointment, and then opening the one that has the screening questions. So it just makes it a whole mess. And then having everything all together integrated, which is something that we're already doing here in TCD, is definitely something that will help you add some value to your day to day and ensure that you're actually going to be reducing on the burnout because it makes it a lot easier on the staff when they're working, and it reduces the number of errors that can actually happen on a day to day. When the call center is plugged in, we'll call it plugged in and proactive, it doesn't just support access, it actually drives it. It drives it. Move number four. We'll talk today about measuring and iterating with real-time access data. So now, the first word that actually caught my attention here is dashboards. So, how easy has it been, thus far to just open up maybe Power BI and then have everything in front of you? And then have a team that actually connects everything, the data from the finance team, the data from the scheduling folks, and then marry it together and then be able to digest it, put it in a way that you can digest it better, and then not have to, generate a million reports that you have to later
Mm,
sit down and evaluate one by one. So I feel like dashboards for reporting and then dashboard also for the different available slots for scheduling is something that is super important,
yeah.
making it
I
easy to
could
digest.
I this one, I mean, jumps out at me when I was first meeting with you and you mentioned this one, my like the light bulbs were off, right? You just did a good job summarizing what the world was like. We had five different Excel sheets. It was all manual. We would go look up the next available by hand and put it into a report and try to compile all this stuff at the end. Or we had the scheduling team had their data, the radiology department, we had our own data, and then we never really mirrored it up well, right? What we did, it was this whole production that took weeks and weeks to do that, and we were always looking backwards. So I love, and you and I were talking about some of the things that your organization does, and that some people out there are doing now. Is you're really meeting with your IT department, you're meeting with your software provider for your scheduling system, or if you're outsourcing or working with people, how that works, and getting a live dashboard. So at any moment you can go in and see how are we tracking, what's our no-show rate today, what's going on with the calls today, or are the calls being answered, or are they not, what's the drop rate, what's our volume looking like, do we look like we have something happening in the main department where suddenly we might have the ability to do some more add-ons? All those elements that sort of, like you said, have to be usually pulled from 15 different reports.
Hmm.
Getting into a dashboard that's really live or as close to live as possible would be fantastic. And, my call out to our members all the time is if someone has it, share it, right? Share the best practice, give a presentation, give a talk, write an article, because everyone out there would love to get their hands on this and understand how to do it well.
Yeah, I think it's definitely about the fact that it gives you a live pulse on the access performance. It's not about, just like a rear view mirror. Like you're just looking
That's
here,
right.
and it's just as important as aligning your reporting cadence with your operational and financial reviews. If you have to review the results for the no shows for maybe like empty rooms, how often is a room empty, marry all that information together and then determine how much it's actually leaving on the table financially. That way access performance becomes part of your routine conversations. It's not just a side report someone pulls once a quarter
That's
to
right.
just meet. So when the data is front and center in a dashboard and your team can actually act faster and iterate smarter and really stay accountable to access goals.
That's right. And my final piece I'll say is also, wouldn't it be great if you had that live? You turn around and say, hey, Jason, great job today. I see that you've had like 15 calls in a row, or I see that you hit all the metrics we're trying to track today. Like, what a great way to do live action, sort of high fives and recognition in the moment. I think it's fantastic.
Yep, definitely, definitely. Now, last but not least, AI and LLM integration, bringing intelligence into scheduling. Now, that fifth move is where things really get exciting for me. It's
Mhm.
all about leveraging the AI and large language models, which is the LLM, to take the chaos out of scheduling by making that experience smarter and more responsive from the very first interaction. So we'll break it down into I'll say maybe two to three different sections. So first, we have the AI-assisted intake and routine. So instead of having patients fill out a form and wait for someone to triage their request, we just use natural language processing, the NLP, to actually understand what the patient is asking for in plain language. Whether it's I need a follow-up for my knee pain or I'm a new patient with diabetes, AI can actually classify the requests and instantly route it to the right care team or the right department or communication channel, whatever the case might be. And this will definitely eliminate that whole manual triage delays and ensure the patient feels heard right away. Because, and again, personal experience, working into a center and then having to wait an hour for someone to come to you to ask you what's wrong and you've been in pain for at least 3 hours, it's definitely not a great experience. Now, being able to be routed right away to the right specialist, like I walked in with a knee pain and now go straight to the specialist going to take care of me because on my way to the center, as I was being driven there, not me driving and texting, I already started inputting the information so they can be ready to receive me once I get there. Now, how would you feel, Jason? Like getting somewhere and then not having to wait that all that time?
Oh, it's as we've been saying all along. I mean, all of these new technologies and capabilities just enhance that patient experience. My answer to you is I would love to have that experience, right? And you know what happens? Like you said, like I didn't mean to joke before about going to the dentist. Pretty straightforward. You walk in, say hello, you're in. What
Yeah.
now? Obviously, if you're going to a hospital, if you're in an outpatient center only, maybe that's a little more seamless, right? If you're just going for a quick X-ray or something really quick, you're in and out. And I've had great experience in certain areas. Bigger challenges when you're in a hospital where the equipment's being shared by the inpatients, the emergency department, and they're sprinkling outpatients in and out, right? Those are a little more challenging, right? Because you're trying
Mhm,
to,
definitely.
how do you create that experience when you're trying to avoid, seeing something you don't want to see or taking care of the most critical moments at the same time? But overall answer is I would love that. And I think I get excited to learn more about some of these technologies and where they've been implemented, and I am really excited to share that then back out to the HRA membership. So they're learning about it and saying, hey, maybe I want to partner with someone, or maybe I want to go on a site visit or get on a phone call and say, can my systems do that? Can I think of doing those things? Years ago, it seemed like it was way out there. Like you'd be able to have this data and you could walk right in. Well, nowadays
Not anymore.
it's
Yep,
happening, right?
it's right there. Yep,
So yeah,
definitely.
I get real excited about all of these things. Yeah.
Awesome. So the next thing that's important to touch on is self-scheduling and AI chatbots. So now we know that patients want convenience. I want convenience.
Mhm.
So why
Mhm.
not give them the ability to book the appointment in real time?
Right.
Now, right from your website or a mobile app. AI chatbot can actually step in and do the work of a specialist. Instead of having a live person that they have to wait on, the AI can assist several chats at a time, guiding them through the FAQs, helping them choose the right visit type. That way, it reduces the level of errors that are committed while the scheduling is happening, and even navigating the insurance or pre-visit questions. So that's a big chunk of the work that's done before they actually get to that appointment, and all without waiting for a call back or without sitting in a queue and waiting for 10, 15 minutes to speak to someone.
That's right. And I think, like we said, I know it's out there. I know organizations that are doing that today. Like I said, I've seen it a lot with screening mammography is kind of a good example of one. I'm seeing people try to roll it out for more complicated modalities as well. And obviously with the AI tools, they can go in and mine the data to find out, did the diagnosis code match what the procedure was? But the key is you got to build all that in the background, right? To make sure things are all matching up and it's following, established protocols either by your radiologist or by American College of Radiology or other sort of associations. But I think this is what patients want. They want ease. They want flexibility. I think to your
Totally.
point with staffing challenges and burnout and whatnot, it'd be nice if you could take some of the more routine elements and let them be done on the AI side. So the schedules are doing the more complicated, the multi-scheduled appointments in one day, the follow-up outside of imaging, maybe with your surgeon or the oncologist. Like let the schedulers be there when it needs a little bit more of the touch, a little more complicated, more questions versus the basics. So yeah, back in the day it probably would have scared me. Now I'm saying this is the way to go. All right, we have to go this path, and it's already out there. So how do we optimize that and keep moving forward?
In other words, AI is now.
That's right. That's right. Today.
So finally, smart automation for follow-ups. So no shows that we've touched on since we started the discussion today, and cancellations actually create a big gap in the scheduling and a huge lost revenue. But with the AI, you can automatically trigger reminders. I did talk about the reminder on my personal experience.
Yep.
Reschedule a missed appointment, um, or even reschedule an appointment that the person can no longer make it, giving them the option. If you can't make it, feel free to reschedule. Availability such, and even offer same day openings to the patients who want to come in sooner. So I have an appointment for next week, and then there's an opening for today. Give me the option, and then just tell me, hey, if you have the time, we have an availability for later on today, within 2, 3 hours. That way, people can really, you know, make sure
Yeah.
that they don't just rush out to make it to your center. But it's
That's
all
right.
about making scheduling adaptive, not reactive.
That's right. And I think to your point, we're using tools now that can be that very easily implemented and doesn't necessarily take away from sort of the patient experience. In the past, we had for example, MRI, right? You didn't want the MRI sitting idle. Our technologists or our tech aides would be the ones on the phone the day before when they got a break, calling all the patients to make sure they were coming, right? Or the schedulers had to stop answering calls and now make outgoing calls, which would add to delays in picking up the phone. So the idea that you can actually use technology to do some of this for you, oh, it's a grand slam, right? And it's
Mhm.
just reminders and getting things out or getting people there and giving them the opportunity to respond. I laugh. This weekend I was away going to dinner with my wife and daughter, and I did something at Open Table. Do you know how many texts I got about, are you coming to your dinner? Is this reservation still good for you? Well, we're looking forward to seeing you. Please click here if you're not going to make it. And I'm thinking to myself, my gosh, how am I not getting the same thing when I'm going for an appointment? Because yeah, it might drive you a little nutty, but you sure as heck are going to show up on time or I'm going to respond to get them to stop texting me. Right. So, but I think it does just takes a burden off some of the things that historically were had to be done by bodies and people. So it took them away from doing something else to do this, which now can be automated. So again, I think it's really exciting. And I think that this is definitely, we're starting to see this much more commonly, put into practice.
Yeah, definitely. And then it's not like you said, it's not just in a medical world. Other businesses actually send reminders, and they've partnered with AI to ensure that the day-to-day is more efficient because it's all about efficiency.
Right. Exactly.
All right. So now, based on everything that we just touched on, and we went through the 5 different moves that one can actually, well, we'll call them steps that one can take to actually, um, search for efficiencies and ensure higher patient satisfaction, because that's really how I see it. I put satisfaction in the forefront. So Jason, what do you think that one can do? Like, let's say in the next 90 days, if I were to actually establish my own business and I'm trying to make sure that I implement all those advice that were given on this session, and for the next 90 days, what would you recommend for everyone to do?
All right. So here's what I would say, and I'll try to phrase it as quickly as I can and as efficiently as I can. I think first and foremost, and make sure you have an internal meeting with your lead techs from your modalities, your radiology administrative team, right? The radiology leaders. So who is it? Is it your chair? Is it the modality leaders, the medical director? What do you want to call that? And your scheduling team leadership. So whoever that is, whether that's internal or centralized. And I think right out of the gates, open dialogue. What are the biggest challenges we're facing today, right now? Is there issues with our system flow? Are we backlogged anywhere? Are there some training opportunities? Make sure that that open dialogue comes so you can understand, are there immediate urgent needs, or is it more, hey, we got some things we got to have to work on in the more longer term as we go forward? Because you want those 90 days, you want to plan. Now, at the base core level, what I'd also do, I would take a look at all your time to next available appointments and all your backlogs. Look at it by modality. Look at it, like I said earlier, about key areas like from a screening and I saw something to when a diagnostic procedure can be done and those type of areas. And then get into the system, right? Your appointment dictionary. When was the last time people pulled it out? Look to make sure that all the appointments you actually want and all the exam types are listed. Are the durations right for how long it's going to take in the room to get done? Are the protocols right in terms of any prep for the patient, any room requirements? Can it be done on certain machines or not in other ones? Are any rules or restrictions like we were joking about earlier from like the 1990s or the 80s? Are they not even real anymore? Making sure your appointment type dictionary is accurate because that's the only way it's going to be clean going forward. The schedulers are going to use the system to schedule. Then I'd pull your templates by room. Are the templates built right? The durations make sense. Are we inadvertently blocking spots that we're never using? Are there blocks that are there for something that has been done once in the last 6 months, right? And why is the block put there? Is there a right reason for that? So I think really taking time to look at your dictionaries, your templates, your system build. That to me would be critical. Then I think based on all the things we talked about as well, with the future technology is, are there other capabilities of your system? Are there ways to optimize some of the workflows? Can you reduce keystrokes? Are there some integration things you didn't know about? Is there data that can be pulled out more easily? Can you use AI to mine the data? Can you layer on some of the things we talked about as self-scheduling or AI capabilities for the callbacks and all those kind of things? How do you set that up? So I think in the 90 days, you could do that, right? Full assessment of how you're built today in the current state and the capabilities you have with your system kind of going forward. I think parallel to that, you also could take your radiology administrator, maybe your some leads from scheduling, and I would say meet virtually or in person with your key referring providers, right? Talk to the people who are scheduling, their offices. How is it for you? Are you seeing something different when you go somewhere else? What can we do to make your lives easier? That should be something that should be happening consistently anyway. But maybe as part of this, hey, we're going to do a 90-day blitz and we're going to improve things. Let's go spend some time so we make sure that we're addressing their issues, not just what we think the issues are. So I think those are my kind of biggest pieces there, right? Sort of that internal assessment of what we're doing today and what capabilities we have, laying out a plan of what we want to do first, second, third, and then making sure parallel to that, you're meeting with your referrers. And I guess you can meet with some patients as well, but I think referrers first, because most of the time the appointment's being scheduled that route. And just really getting a lay of the land and sort of burning platforms and keep key priority next steps over those 90 days. My 2 cents.
Yeah, definitely love it. And then before we close, I'll just pull together, but then looking at it through my operational lens. And with something else, I'll say it's very real and tactical. People and tools that are behind the day to day, and maybe think of what staffing really means. And then, because at the end of the day, none of these strategies will work without the right staffing model, the tech stack, and the training. So one thing that I would recommend today, in addition to everything you've said, Jason, and I'm sure you'll have thoughts on this, is staffing audits. Questions such as, do you have the right number of specialists handling access and scheduling? Are
Right.
they trained to manage the complex patient needs, not just answer the phones? And are they using tools like centralized dashboards, real-time slots visibility, or the LLM-based assist to actually support that experience? I mean, if not, I think it's time to make those changes.
That's right. I think more than anything, when you say what can people do, stop what you're doing right now, dedicate time to take a look at what's going on with your scheduling services. That is your, like we said, the front door is probably the most important part of the operation. If you get it wrong up front, it's all going to be wrong downstream, right? So I couldn't agree with you more. This is a chance. It's sort of a call to action. Hey everyone, stop, pause, dedicate time, get the right people in a room, and look at all these elements you mentioned, some of the things I mentioned, and put a plan forward and then do it again in 6 months, right? Or less. And
Yeah.
it's something that's constantly moving because there's so many changes in the marketplace and the new technologies and this, that, or the other. I think it's important just to keep doing that and aligning everybody on where we're headed, targets, and how we're progressing.
Now, just to close, and I will close with a question to you, Jason. And the question is really to give people on the call today a sense of what matters between people and process. So my question is, what's more important to get right first, in your opinion, the tools or the team? And how would you balance both when you're under pressure?
Right. Honestly, without even hesitating, people to me are always the most important, right? And that's just maybe I'm old school. I used to watch the those old movies with Hal, what is it? The Space 2000 or whatever it was, well, they had the computer that was doing all the work and I'd laugh about it. Computers are great, technology is great, tools are great. People are where the real connections happen, right? And when someone's really scared and really nervous and they're looking for that really exceptional experience, personally to me, I like to have talk to someone. I like to have that connection. I like to hear that someone cares. I like to feel that I'm heard. So I think getting the right people is key, that understand they want to be there. They want to be they understand what the role they're stepping into. And then number two is you absolutely need to support them, right? We need to train them right. We need to give them support. We need to allow them to fail to a degree, not to hurt anyone. And but we also need to make sure that then we need to build the tools and resources around them to make their job easy, to make it enjoyable. They want to be there, they feel engaged, they feel that they have meaning and going down that path. Now that's just me. Some people may say, you know what, go to automation all the way and we don't need people anymore. I guess I'm more the old school model is I think people first. So I don't know. I'm probably gonna be told I got to meet more in the middle, but that's just my thoughts.
I think I'm right there with you because I'm a people person and I feel like the genuine connection only happens when there's a person involved.
Right.
And the machine doesn't have what we have.
Okay. It can
So
help, right?
it
It can
can
help
help.
us.
It
Right.
definitely helps, but it just doesn't have what we have. But yeah, I guess that's where we're wrapping it up. Thank you everyone who joined today. Thank you very much for your time, Jason. This was a great session. I think I've learned more than everyone else on the call, honestly, from you and all those 25 years of experience, which have been demonstrated on this call today. And I will close with saying eliminating schedule chaos, sorry, isn't just a tech or ops project. It's a strategic lever that touches patient access, revenue integrity, staff well-being, and I'll say mission execution. We hope the session actually helped everyone reframe the issue and see the solution more clearly through the different moves that we've presented today and feel confident about your next step. So stay tuned until the next webinar from CCD.